when I say dealing with social issues and community issues, the opioid crisis in the US, the opioid epidemic has been ongoing for many years. And we thought that would be a good example of a challenge that healthcare systems face that we wanted to build into the simulation, and students to be able to make decisions about how they would handle that and what would be the repercussions for their entire healthcare system. So that's exactly what we did. And we also thought carefully about the COVID pandemic. And we thought that at least at the current time that we were developing the simulation, that not enough was known about the COVID pandemic. And in some cases, a little bit too close to home, because many of our students are on the front lines and providing healthcare services. And so we decided to focus instead on the ongoing opioid epidemic, which has been a very difficult and still remains actually, and I predict will remain, right, an important crisis, an ongoing epidemic even after COVID starts to wane. And that is we're already starting to see that in the United States. So yes, the opioid epidemic and, as I said, the focus more on primary care. And those two go hand in hand, because strong community-based prevention programs in primary care, that really is looking outward from a hospital. And it's really looking, I think, into the future of where healthcare systems in the United States need to move, and in other parts of the world as well. Less focused on inpatient care, more focused on community-based services, outpatient care, primary care, and prevention programs. And so we built into the simulation the opportunity for the students to acquire a primary care clinic. So the students have to make decisions about that acquisition and subsequently about integrating that clinic into their system. And that's particularly true on the human resources side. It's true for strategy, but it's also true for human resources. So we built in a fairly complex decision the students have to make about acquiring a particular type of primary healthcare clinic and bringing that into their healthcare system. The telemedicine is an important component and of a healthcare system, at least in the United States, has become increasingly important as a result of the COVID pandemic. What we saw here in the US was a sharp pivot and a sharp increase in the number of individuals who are getting their healthcare online. And as a result of that, we decided to build into the simulation the opportunity for the students to manage telehealth services, to make decisions about how much they're going to invest in those services. As you said, what types of service lines will have those services, and what will be the repercussions financially for access to care for the entire system. And we don't know, to be honest, we don't know exactly how telehealth services are going to develop in the United States. If, for example, the policies will continue for health systems to get good payment for the telehealth services that they're providing, that would make it feasible for them financially to continue to provide or even grow their telehealth services after the pandemic. But we decided that it was an opportunity that we should build into the simulation and provide the students the challenge of managing telehealth services. We built in a competitive aspect to the simulation. So these teams are actually managing 3 or 4 health systems in the community, depending on the number of students that we have. And they're competing with each other. So it does simulate the reality of a health system that has local competitors that has to, for example, attract top physicians and nurses to work in their system and retain them. And there is a limited number of patients. So the teams are competing with each other the way that health systems compete for critical resources, at least here in the US and community-based health systems. And so there is the plenary sessions where I'm providing feedback to the students. There is a common denominator because they're competing against they're competing on these common metrics against these other systems in their community. So there is something at the end that is also exciting because we announce, right, the ranking of the teams, how teams did across the key metrics in the community that they're simulating. So there is a common understanding across the teams of exactly what's going on. We built into the simulation that students can see competitor data. They have access to data about how the competitors are performing, just the way that they would in real life. And they can see what they're doing. They can see how they're doing up against the competitors. They can benchmark up against them. And then in the plenary sessions where I'm giving feedback and coaching, as you call it, there's an opportunity for common learning because of they're having that shared experience across each round of decision making.